Alhamdulillah.
Sorry guys, just in rounds. I'll come in and out.
Yeah, I'm in rounds too, but I told them to leave me alone for an hour.
Okay. You
There's no
look good.
guarantee.
You got your coat on and everything.
Yeah.
Assalamu alaikum, Dr. Manaf.
Should we start?
Yes, actually, I started a broadcast too.
Okay. Oh,
So we can begin, Sapura.
okay. So, Bismillah and Assalamu alaikum, and welcome to our latest installment of our series of Zoominars, where Cornerstone Law Services provides legal and financial tools for Muslim families. And it's our way of making legal and financial tools understandable and accessible to all of you. So we have been bringing in experts in many fields relative to our unique situations. So hopefully this will allow you all an opportunity to ask questions that are unique to us from people with extensive knowledge in those areas. And we brought in experts from many different, usually the financial side of things, but now we've been, the last week and this week, we've been discussing children and the effects of COVID on our children and how we can prevent that. And we have great doctors from our community joining us today. We have Dr. Ibrahim Omarji, who's a pediatric specialist in Bakersfield, and he has over 9 years of experience in the medical field. He's graduated from Ross University School of Medicine in 2011, and he's completed his residency at Stony Brook Hospital in Long Island, New York. And so we also have joining us today, Dr. Shema Khan, and he has done extensive volunteer work locally and abroad. He teaches residents at UCSF and Stanford with a focus in orthopedics, trauma, and sedation. He's actively practicing pediatric emergency in the US and all over, actually the US, and here in Southern California at Kaiser. We have Dr. Ghazi, a pediatrician at Kaiser Permanente in Orange County and a co-founder of the Ummah Clinic in Los Angeles. Please take your, we also are joining with Dr. Manaf Qadri, and he's a board certified pediatrician and a neonatologist. And we, hopefully you all take advantage of this opportunity with these great doctors and ask questions in the question section. Or you can email us at info@cornerstonelawservices.com or check out our website, cornerstonelawservices.com, and we will get your answers to you. As usual, I would like to emphasize that the purpose of these webinars are for educational purposes and not intended to be medical or legal advice. And please contact a legal professional to develop a proper plan that's right for your own personal situation. And so as we wait for Dr. Omarji, is he?
Yeah, he's coming in as a panelist. He's actually logged in from the attendee side. So
just to recap.
Sorry, you want to remind everybody that, so who are the folks that are watching this on Facebook, your questions, you can actually ask the questions, type them up, and then we can come back to them a little bit later because we won't be able to answer the Facebook attendees live with the questions. But hopefully their questions, they'll get answered, but they have to type them in.
I'll try to do my best, but no promises during this.
Okay. Will you be able to give Ibrahim access, Hani, or is it, because I'm not
be able to log in just like everybody else did with the link.
Okay.
So while we wait for that, I just wanted to recap. Last week we discussed symptoms you can look for in children, and the doctors talked about fever and runny noses and fatigue. And we discussed ways of prevention. Dr. Shema discussed really building immunity, making sure the kids are able to fight off infections. And we talked about stress relief and rest and, things like that. And also testing and how it's not really very favored, apparently it seemed like with the doctors. Anything else you guys want to recap from last week?
Yeah, no, actually, I just want to make sure that it's clear that it's not that testing is unfavored. It's a question really of testing appropriately, particularly given the children they have a difficult time, right? Because you have to really put the swab way in and you have to really be more aggressive. and keeping them in place. So it's really important. And I think that's something that we should talk about today, particularly Altaf, with you, being in the position you are at Kaiser, a lot of administrative things that you're doing as well. So you really have to kind of make those policies and procedures, right?
Right.
And it's also important, and they're kind of all over the place a little bit too, from different practices to different practices. So can you, Ibrahim, of course, I'm going to have you start the presentation. Hey, welcome, Ibrahim. Ibrahim, you can go on, you can actually click on your picture on the right top, there's a blue box that's there. Click on that, and that'll give you the option to change your name from Gabe, to Ibrahim.
Oh, I'm Gabe, huh?
Yeah, you Gabe right now. I mean, it's
I like
okay.
Gabe.
We know you're not
It's
Gabe,
okay.
but we can deal with it. So you know what I'm talking about? Did you see the box when you clicked on your picture? If you move the arrow,
Yep.
your mouse arrow, yeah, there. Okay, and then also, then you know how to use share screen, Ibrahim?
Yes, I do now.
On the bottom, there's a green button. Click on that, and that'll allow you to share your screen. So, what we'll do today, though, is I'd like to have you be able to just continue and finish your PowerPoint, so that once you're done, because I know Altaf had given also points that you've incorporated into your PowerPoint, and then we can really get into a discussion about it. But I really like to see if you can get your thought process onto the board here, so we can all.
Yeah, I
discuss.
think
Yeah,
I think the
absolutely.
best thing is to cover a slide and then let everyone do their input, and then we'll move on to the next slide, kind of in
But
that.
I think that might take too long, Sephora. I think it's in my feeling. I think
Okay.
How many slides do you have, Ibrahim?
Not too many, about 12, 13. We'll just go through it real quick.
Good.
Yeah, perhaps Dr. Omarji, Assalamu alaikum, by the way. It's good to see you. Maybe we can have Dr. Omarji complete his slides, and then we can go to discussion and look at the chats and whatever points that the moderator wants to bring up as well. Inshallah.
Sounds good.
Inshallah.
Okay.
So real quick, before we get started, we have, alhamdulillah, we have, a lot of panelists here, and everybody's very knowledgeable. And, based on experiences, there's going to be some differing points of view. It doesn't mean anybody's wrong. It's just different opinions. And, that's the best part. It shows people are thinking. So we'll get started. So last time we stopped around here at the slide before this. We were just looking at, we just talked about treatments, and there is no really outpatient treatment for COVID. So we just talked about supportive treatment. So testing recommendations. So as per the CDC, children with symptoms, children with quote unquote close contact, and close contacts less than 6 feet for more than 15 minutes. So that's what they refer to as close contact. The other people or patients we check are kids or patients who are about to get surgeries or going to the hospital for any reason. And then another thing I just want to bring up real fast is that when we do get phone calls, a lot of times, the exposure or such, or the child has only been sick for a day. And the important thing to note is testing right away is not very accurate. So a lot of times we'll recommend let's wait a few days, at least 5 days before you test, closer to 7 days. So after the infection, most kids get better, 99.9%. And, we know kids don't get this infection nearly as severe as adults do. So that's the one silver lining in this for us. But there is an entity that sometimes, pediatric patients can develop. And I'm sure it's been across the, you've heard across the news, it's multi-inflammatory syndrome, or sometimes they refer to as Kawasaki's. But basically, it's this thing that happens about 2 to 4 weeks after the initial infection, where a child gets very sick very quick. And this can actually be very concerning and needs hospital treatment. I think the last I checked, there was about 950,000 confirmed cases in the US and within kids. And there's been about 11,000 cases of MIS. And outside of that, about 20 kids have unfortunately passed away from it. So it's very small, the amount of kids who get it, but it's something definitely to keep an eye out for. And you'll see this rapid deterioration of a child's condition. Usually elementary kids, 8, 9 years old. And if you're ever worried about that, that's the one thing that we don't want to take lightly, even though it's rare, but that's the one thing. And the other thing to say is that this is not just isolated to COVID. We see a very similar syndrome, Kawasaki syndrome, in with other viruses as well. So the treatment is very much the same. So prevention, that's another big thing, and that's really how we're going to get, beat this thing. So we talked about this a little bit earlier, but the usual things, mask and distance, that's probably the most important, two most important things. Any recommendation anywhere when it comes to sports, school, everybody, everywhere, every expert will stress distancing and wearing a mask. And these two things are going to be key going forward in trying to prevent this. So if you're ever in a situation where you're around people, remember distance, 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 that's going to be big. And the other thing, sleep, diet, stress, faith, these things all can affect your immune system in large degrees. So something definitely not to forget about. I forgot to mention hand washing. That's the other thing. So the vaccines, I'm sure, and again in the news, it's been all over the news. Pfizer has a new vaccine that's supposedly more than 90% effective. One thing to remember on these new vaccines that are coming out, some of these are new technologies. They're experimental. They should work on paper, and these are just trials that are happening. So we don't know if that 90% is going to hold up once it comes out. I mean, it's encouraging. It gives us some reason for hope, but we're not going to have that many doses out by the end of the year, and it's going to be a while before it's available to everybody. And I think it's going to be even longer before it's going to be available to the pediatric population. Number one, there's been no studies completed in kids with this new vaccine. And number two, kids are a low risk group to begin with. Like we were saying last week, I think there's been 18,000 cases, 17,000 cases in California, and 2 pediatric deaths. So the vaccines will probably aim toward higher risk groups, at least initially. And then the other thing, we're coming into flu season, and I know because flu's been around every year, it's sort of, we don't think about it as much, but to put things in perspective, so far 120 kids have passed away from COVID. And it's a horrible way to look at things, but just to keep in mind. And last flu season, 188 kids passed away from the flu. And 180 kids passed away, but there was a lot of hospitalizations, a lot of complications that, they didn't pass away, but required hospital stays. This year, hospital beds are going to be at a premium, especially with what we're seeing with the COVID numbers going up, especially this winter. So in order to reduce the burden on our system, in order to reduce the burden on the patients and kids and people, we're recommending everybody get the flu vaccine. And we're really, really recommending. I think this year is going to be more important than previous years just because of COVID. And last year was a tough year. Last year was a tough flu year, if you look at the numbers. So school, the AAP, our Academy of Pediatrics, they strongly recommend that, all policies should be aimed at getting kids back in school. We know distance learning is not an effective way of learning. There's a lot of implications that are negative implications from distance learning, poor socialization, poor learning. It's difficult to do, and it's not feasible or sustainable for a lot of families. So the idea is to get kids back in school, but there's a lot of policies and a lot of things that schools got to adopt and be consistent with, and a lot of schools are not. And it goes case by case, district by district, school by school. And you also got to look at the numbers. If the numbers are getting higher and higher, then maybe it's not a good idea. So I know there's a big rush to get kids back in school, but it's still something that's going to go slowly and methodically. So some of the things they recommend, limiting class sizes. So 25 to 50% of what's, the normal class size, distance between desks, masks for kids, kindergarten up, cohorting classes, meaning the same group of kids go to lunch with nobody else in the cafeteria, or go to play outside with nobody else playing outside, pickup times, drop-off times, staggering them so that, the groups of kids aren't together at the same time, emulating high-touch areas, disinfection policies, good ventilation. So you can see with all these policies, it's going to be very challenging for most schools to consistently do this. And then at school, when a student is exposed to COVID, what's the policy? What's the school policy? So as per the CDC, it needs 14 days of quarantine, regardless of testing, because there's a false negative possibility. When a student has COVID and is sick, then the recommendation is 10 days from the beginning of symptoms and 24 hours after you get better. So whatever comes later. And this is the big gray zone. What if it's just a cold? What if it's something mild? Nobody else is sick in the house. You know your child has allergies. You know your child, when the weather changes, gets sick, has asthma. And we all have patients in our panel that do this. And that's when it becomes a big gray zone. And at that point, I would defer to, that child's physician who knows them best or her best. These are just handouts from the CDC for parents. I can send the link out later to these if people would like. Basically what to do for parents, what to do for teachers and school nurses. So just help creating consistent policy on that. Sports, a lot of sports have been starting up, and in my area, football is a big thing, and they're practicing again, and it goes sport by sport in terms of risk. There's the lowest risk sports where you're by yourself, and then there's the highest risk sports where you're competing with a large group of people from different regions. And again, you take it sport by sport, setting by setting. Where are you playing? Are you playing indoors, outdoors? There's going to be a lot of people there. Is the district or the conference enforcing these policies where there's no visitors, masking, referees, and things like that? So sport by sport, it's an individual by individual basis. And then a lot of schools require testing before the kids start, which we don't recommend in general, because what if it's a false negative? It gives us a false sense of security that everybody's okay when they're playing. Daycare, same policies at school. It's important for daycares, especially ones that haven't been organized well, or these small ones where it's just at the house, 3 to 4 kids, that they have some kind of policy where they're checking their temperatures. And this is something made by the AP, which is a questionnaire that parents should fill out every day when they drop their kids off at school. And then pregnancy. Only 2% of babies, around 2% of babies are test positive within, a few days of being born to moms with COVID. And out of those 2%, very, very few, I don't know if any have shown any severe symptoms or have had severe outcomes. I might be wrong, but the number is low. Breastfeeding, we still encourage it, just use the proper precautions, masking, hand washing. If it's possible, give the child off to another caregiver when not feeding for the requisite amount of quarantine. And then after that, you can go back to normal. Real quick, last slide, some things to remember. The recent surge that we've been seeing, it's driven in large part by small family gatherings or friend gatherings. So, we're doing a good job avoiding big groups outside, but small family gatherings. Distance is key, wherever you are, indoors, outdoors. Distance is important. Do the best you can with distance. If you feel uncomfortable somewhere at a grocery store, keep that distance. That 1 foot might be a difference between you getting it or not. And then we thought previously masks would only help the people around you in case you had it, but there's increasing evidence that it might protect you as well. So again, wear a mask at all times if you're out, especially if you're going to be around people, especially if you're going to be indoors. And you're going to run across a lot of myths, a lot of misinformation, a lot of false news, people pushing their own opinions without any data really. Some things like it's like the flu, it'll go away, and then there's a lot of quackery, a lot of misguided medicine that haven't been proven to help. So be wary of that. If you're ever concerned, or shoot an email to your doctor and ask them their opinion. But you're going to find, if you have 20 people, you're going to find 50 different opinions on it. And so that's where you got to be careful about whose opinion you're taking. So that's it for my slides. If anybody would like to chime in and add to it, that would be helpful.
There's a lot to chime in and talk about, I'm sure. Altaf, I want you to kind of bring up your experience in this as well. Do keep in mind that we have principals of our local schools as well as other schools watching. And so I think there's a lot of interest in how should they handle. We have from the OCS, from ISLA, from Minaret, teachers and principals that are watching here on Facebook or for a little bit later recording. So Altaf, can you speak a little bit more regarding school, what kind of policies that Kaiser potentially recommends for kids, and particularly for those that are going to school?
First of all, I want to thank Dr. Omarjee for excellent presentation. You covered a lot of points, and one of the slides had on there at the discretion of your pediatrician. And I think with COVID, the best way to summarize things, I'll get to your question in a second, Sana, is that a lot has evolved. The information that we give today is different from the information we were giving in July and August, and it may change in a month from now. And there's a lot of individual nuances. So whether it's principals on the phone or parents on the phone, if there are specific scenarios or specific questions, the best course of action is to consult your pediatrician and go over that case specifically. These are just kind of general guidelines. As far as your question, Kaiser doesn't really have a specific guideline. We follow what the state has put out and what the American Academy of Pediatrics has put out. In general, I think we all agree that in-person education, those of us who have parents who have a bunch of kids holed up at home on virtual in front of screens can attest to that there are a lot of other aspects of education that virtual programming just does not fully satisfy. There's emotional needs of kids, there are social needs of kids, physical activity. Kids learn how to interact with adults and kids in a school environment. They learn leadership skills. And so I think the Academy of Pediatrics, looked at the experience that we had in spring 2020 when everything went into lockdown, and they, all educators and the Academy of Pediatrics, I think there's unanimous consensus that the virtual educational model did not meet the needs fully of kids. Now, that being said, we have to balance that with what's going on in the community and public health risks. And so there are clear guidelines for when schools can open, and they have to be in the red tier for at least 2 weeks continuous, which is the second risk tier that the governor Newsom has put out. Purple tier is the highest. So initially, when we looked at August opening, schools could not open because majority of counties in California were in purple tier. So we had to wait till they got into the red tier. That being said, once they have been in red tier, a number of schools have offered different models, whether it's traditional 5 days a week for younger kids, elementary up until grade 6. For middle and high school, my understanding is traditional is not an option because of just higher rates of disease transmission in older kids. And so hybrid is an option where you can go 2 days a week. And that being said, again, I think it's an individual decision. So you have families who have high risk individuals at home who are immunocompromised. And I would recommend in that situation that all the family, the kids stay virtual. So even the schools that offer in-person programming in all of Orange County, I know the public schools, they also offer an online format, and I believe all the Islamic schools are doing the same. So there are options, and this is where I think we don't have one answer to answer your question. It is an individualized decision based on the risk factors of the family and the level of comfort of the families. My kids, for instance, are in hybrid, but I have colleagues and friends who have elderly parents living with them or immunocompromised individuals, and for them, I would push for being virtual. And then there are clear guidelines that schools have if there is an exposure, which Dr. Omarjee covered pretty well.
Yeah, very good. That's really, really good, Altaf. I mean, you're so right. I mean, I think that individual families really have to look at it because Ibrahim, what you were showing, the data was really interesting, right? Because the kids are very low risk from the perspective of them themselves having a fatal outcome. Now, what we don't know is potentially what the effect of COVID is when someone we're looking at fatality as one outcome that's the worst, right? But you don't really know how else it would affect potentially other systems and organs later on in life. So the fact is that everyone should do their very best to be preventative, right? But then also, you know, Altaf, as you're saying, if somebody has immunocompromised grandparents at home, or, you know, somebody who's potentially on steroids, or potentially on other kinds of situations, that they should be much more careful. Is there a place that you guys have? I'm talking both Ibrahim and Altaf, you. Is there a place that, like a flow chart, to say if your family falls into this category, we recommend this, and if it falls into this category, we recommend that? Or should a flow chart like that be made? I mean, I don't know if you guys have one or not at Kaiser.
As far as I know, no, we don't. And it might be helpful, but there's so many different scenarios for each family. And so it might be a little challenging in that.
We don't have a flow chart as far as I know, but one thing that we have done in medicine as a whole, and a lot of businesses and industries have done, is they've switched to virtual models of care where we offer telehealth visits by telephone or virtual, by video. And so some of my visits are exactly this kind of scenario where parents want to discuss what is the safest thing for me to do with my kid. And I think a flow chart would be very difficult to develop. It's a very individualized discussion. We have guidelines, and we discuss those guidelines with the families. And you know, we've posed this question to infectious disease experts in the pediatric community, and most of them will not give a standard answer. They will say that you have to assess the level of risk in that family, and you have to assess the level of comfort of the parents. And so it's a discussion is what I would say. And we offer virtual visits for that.
Excellent. Okay. What if somebody doesn't have Kaiser? Shema, are you still on? Right. And just...
Sana,
Yeah.
let me just jump in a question, and I wanted to ask Altaf in terms of comment on both of you guys. And my views are different because as a NICU, we are obviously dealing with super sick babies and, you know, concerns with moms with COVID. And, you know, luckily our babies have not been ill with COVID, although the symptoms that they can present can be masked by the fact they're premature or ill anyway. So to differentiate between COVID and prematurity and illness, it can be difficult also. So that's what makes it hard to decipher between the two, what's causing what. My question to Altaf would be, in terms of testing, what are the views in terms of testing of kids, and how do you go about? And I realize that a lot depends on what tests are available, and, you know, how, if you could get the tests. I just wanted to have him comment on that.
I think Dr. Omarjee's slide covered it pretty well. In general, what I would say is that children who are symptomatic, who have, and there's a whole list of symptoms that Dr. Omarjee showed, there really, you know, when we ask the pediatric infectious disease experts, there really should be a low threshold for testing those kids, because now we have testing capability. Now, this was a different conversation in August. It was a very difficult conversation. Parents wanted their symptomatic kids tested, but we just didn't have testing capacity. And then what Dr. Shema had said in the last webinar about, you know, those kids sick enough to be admitted to the hospital or presenting to emergency rooms, those were the kids who were being tested in August. But now, alhamdulillah, we have a lot more testing capacity. So kids who are symptomatic should really be tested. The one that becomes a little bit of a gray zone, and Dr. Omarjee touched on it very nicely, is what about those kids who have baseline allergies, or their symptoms are not really much different than what they have year round? That's a little bit harder to tease out. My personal opinion is, if those kids have face-to-face interaction outside of the home, in other words, they're going to traditional or hybrid schooling, or they're doing sports or after-school programs, we should still test them, because there's no way myself or Dr. Omarjee or Dr. Fauci, for that matter, could tell you that this is not COVID versus baseline allergies, because there's so much overlap of those symptoms. But again, if those kids are just at home and have no out-of-home contacts, and their symptoms are in line with what they have year-round, then it may be reasonable to hold off on testing. And so that's where I think, for those parents on the phone, if any symptoms develop, the first thing I would advise is a telephone appointment with your provider. And it's not just Kaiser, a lot of private practice physicians have also ramped up their telehealth capacity.
So I'm going to turn to vaccines for a little, because sometimes that tends to be a hot topic. But so Dr. Omarjee, you actually said that that Pfizer is claiming that they're more than 90% effective, the vaccine, right? What does that exactly mean, 90% effective? Does that mean that you get less 90% symptoms, or you get 90% of the people that are getting the vaccine are not contracting the virus when exposed to it?
From my understanding, if you're exposed 10 times, it should protect you 9 times out of those 10.
Oh.
But this is from their trials and not actual results. So again, I am not sure and not certain that 90% will hold up when this actually goes mainstream.
So follow up to that, the 90% is interesting, is because don't forget, you're 85 to 90% people are asymptomatic anyway to begin with. So how do you, how do you decide which one it's effective on and which one it's not? So that's going to be the interesting question. That's going to be 90% is great for our, pediatric population generally for vaccines. So I think that's going to be the interesting point. Like, are we getting the 90% that we're going to be ill, or are we just, those are the ones who are not going to be ill anyway?
Right. And Manaf brings up an interesting point, that the 90%, my understanding when I read the vaccine trials, it's based on 44,000 enrolled patients, and 94 have gotten sick thus far. And the way clinical trials are conducted, they're double blinded. And so the investigators and the pharmaceutical company even don't know who got placebo out of those 94 and who got vaccine. But there's an independent board that analyzes that data, and they came up with a statistical analysis out of those 94 that 90% of those people were 90% were those who did not receive vaccine. And so this is statistical modeling on a sample size of 44,000. And so we know that when this gets rolled out to millions and millions of people, that 90% may not hold up as the sample size gets bigger. And Manaf brought up a very interesting point. The data thus far has not assessed the ability of the vaccine to prevent asymptomatic infection. So keep in mind, the 94 people who got, the 90% is derived from those who developed symptoms and got sick and were tested. But we know 30, 40, maybe 50% of people with COVID are asymptomatic. So at this point, we don't know if the vaccine is going to prevent asymptomatic infection. But the one thing I would add is that if that 90% holds up, even if it's 70 or 80%, it has the potential to be a game changer in our fight against COVID. Because at the start of vaccine development, if you guys recall, the investigators and the public health community were hoping for something that was on the order of 50% effective. That's what the flu vaccine is generally. So if this is really going to be 90% effective, it approaches the efficacy of things like measles vaccine, which has the potential of really being a game changer. But again, this is preliminary data.
Yeah. So when it comes to kids, then do you suggest that, when the vaccine initially comes out, do we suggest that we hold off on the kids from getting the vaccine and really focus in on the, I think you were saying this, focus in on the more vulnerable, I think, Ibrahim, you were saying that, right, of the population initially, protect the elder or the people that comorbidity, and kind of just watch the kids? What are you guys thinking? I mean, because I know everybody's going to want to, not everybody, a lot of people are going to want to run and get the vaccine, right? And I'm even hearing rumors that they may even make it so that whoever gets it can travel, whoever doesn't get the vaccine can't travel, just that kind of stuff, right? So, but what do we do with our kids? Do we recommend getting it? Or you guys, you're not sure?
Well, unless you're a sheikh in the UAE and have lots of money that you can just buy up the vaccine for your family, it is not going to be our decision. The allocation of this vaccine and who it goes to is going to be dictated by the FDA, the CDC, and the government. not going to be Kaiser's decision either.
Oh.
And, we just had a webinar on this, and Dr. Mark Saltzman, who's one of our pediatric infectious disease experts, his prediction was that in its first rollout in the final quarter of this year and early into 2021, it will go to the most vulnerable patients, which statistically right now, the large percentage of deaths have been in skilled nursing facilities. So it'll probably go to skilled nursing facilities and the staff at skilled nursing facilities first. And then it'll be a phased rollout, probably with first responders and healthcare providers in the first, half of 2021, and then to more vulnerable adults, such as those who are immunocompromised, those who have morbid obesity and other risk factors. Pediatric patients will probably be way down the line. And thus far, Dr. Umerji did bring up a good point. The data has not really been studied in pediatric patients. They just applied, I think in September or October, to start enrolling kids from 16 to 18, but the initial 44,000 in the Pfizer trial is adults. Now, hopefully kids will have just as robust an immune response, but we don't have data in the pediatric population yet. So that may also hold up rolling it out to pediatric patients.
Shema, are you seeing more, is there an uptick in the ER for kids and adults for COVID right now?
So first of all, thank you guys. You guys are doing a great job. What I can offer here is basically there is an uptake in patient volume, but not an uptake in positive tests. Now, what that means, sick positive tests, that patients that are being admitted through the ER, right? So you have a lot of patients that have positive tests that are being currently like asymptomatic. They're being used for screening purposes, isolation purposes, but I'm talking about like sick kids that are being admitted. So I don't see an uptick in that, no. Now, we do have a lot more positive cases that patients are presenting to the emergency department, like, hey, I just got a positive test. It's over the weekend, my pediatrician's out, I called the nurse and they said, go to the ER. Like Altaf said that, like the video teleconferencing, audio calls, et cetera, that parents are trying to reach out to a provider. So when they come to the ER, a lot of the discussion is and I think Omar, you kind of highlighted like, one of the big things that we should not be saying is like, this is just like the flu, right? But for the vast majority of it, it's actually quite similar. That's what we're telling them in the ER. It's a viral infection, right? And, expect to see symptoms like the flu, but these are the things you need to look out for. You talked about multi-system inflammatory syndrome with kids. And, these are very sick appearing children. And there's a constellation of symptoms that they present with. But in conjunction with that, it's also one of those things where, there's supplementary lab investigations that kind of guide our decision making. And, based on X-ray, oxygen need, et cetera. But in terms of morbidity, I have not seen a higher uptick in patients or patients that are being admitted. It's kind of like business as usual in that sense, but you're having more positive tests.
I mean, is it because kids are developing more symptoms, or is it because there's just more testing going on?
Like Altaf said, more the game has changed, right? We have exactly. I remember working at urgent care. We were, testing random patients. Now it's like anyone comes in, we're testing them, and they have drive-by clinics to be tested, different things. Now, the issue I think that we're all trying to overcome here is like, when to test, when not to test, when to return, when not to return. And these are all personal questions, that a lot of parents have to make at that time. Is your child sick? There's so many parents and so many people that definitely have symptoms, but they're ignoring it because they're scared. The uncertainty that we're seeing in the media, the uncertainty we're seeing all around us. And like Altaf and Ibrahim, Munaf, all you guys will agree that a lot of this, we're still not very sure. And especially in the pediatric population, like with vaccines and all, the data is not out. But, as we progress down the road and as election hysteria settles down, I think a lot of the things go down, you're going to see a little bit more concentrated focus on trying to contain this rather than all the other uncertainty going everywhere.
Yeah. Yeah. So, okay. So, because I think the biggest question right now at least from my surroundings is that schooling. This is by far the number one question that I'm seeing from parents at the masjid, at the boards, all that is that what do we do with our, I mean, in our case, right, there's the Islamic schools, but obviously it's every school.
If I can offer something, so maybe we can all kind of go through, Altaf, being in Kaiser and setting policies. He can kind of tell us what his thoughts are, Ibrahim, and I'll tell you mine, and then even Munaf, all of us, we can get 4 different opinions here, and we can put them all on the table, and they're all right. They're not wrong, because what everyone has to understand is these are recommendations. These are not mandatory. They're all recommended. And that's why Altaf, going back to Altaf's point, it's changing, it's evolving. As we know more, we change our data, we change our recommendations.
So I guess Altaf will start off with you, because you're talking to principals here right now of schools. What do you say?
I think I said it at the introduction. What I would say is I think we all agree that there's value to face-to-face education that virtual education simply cannot completely match. It's like infant formula versus breast milk. We can come close, we can try to manufacture something, but breast milk is, natural. It's Allah's creation. We can't beat it. And so I would say to the principals that you rely on your public health guidelines in your local counties and local jurisdictions. If there is, allowance to open up to face-to-face education, then I can speak to what Irvine Unified School District is doing because I work with them most closely. They have opened to hybrid and traditional for the younger grades in mid-October once they were at the red level for 2 weeks continuous. Now, that being said, they also offer fully online, 100% online format because that is what is needed for certain families based on their risk factors, their level of comfort. I have parents who are both first responders or essential workers, and they don't have anybody who can take care of their kids. So we have all sorts of scenarios that play out. And the other thing that I would say, and Shema and Dr. Muji touched on this, is flexibility. As more data comes in, as we learn better about the virus, and as the local transmission rates change. So Irvine Unified, for instance, at each trimester, they allow parents to reassess their decision and flip-flop. In other words, if they were virtual, they can now go to hybrid and et cetera, or they can go from hybrid to virtual. And so there should be some flexibility built into that allows families to make the best decision. And so sometimes I have parents that are very hesitant when I have this discussion with them, and I tell them, look, if you're hesitant and you're unsure, go virtual for now, reassess at the next trimester, we'll talk again, let's see what local transmission rates are. So I think, in a nutshell, I would say face-to-face education is superior, but it's dictated by each family's situation. And the third thing I would say is flexibility, where we allow reassessment at certain points.
No, but let me get away from the parents a little bit. Let me talk to you about the principal. What should the principal be doing in a school of 200 kids or 250 kids and someone tests positive?
So that's a different scenario than the decision to send my kid to school or not. Right. Again, there are very clear guidelines for that. And I work with IUSD on this. The guidelines, and Dr. Omarjee has it in one of his slides, is that the child who tests positive is immediately isolated for 10 days from the date of the positive test or onset of symptoms. And then those who are close contacts, and the close contacts are defined as less than 6 feet contact for 15 minutes duration or more. There's been a little bit of updating of how that 15 minutes is defined, but we'll just keep it simple for now. Those kids should be quarantined for 14 days. And the schools, not the provider, the school figure out who the close contacts are, and they involve us, and they involve the pediatricians to clear the symptomatic patient to come back to school. And so there's no need for repeat testing, provided that the child has completed 10 days of isolation and is symptom-free at day 10 and at least 24 hours fever-free.
What about the rest of
the kids who are exposed need to sit out for 14 days. And the reason for that is the incubation period of the virus, that, you may develop symptoms anywhere from 2 to 14 days, about 2 to 13 days roughly from exposure to the, to the point where you may develop symptoms. So if you sit out that full 14 days and you have no symptoms, then you can return to school. A negative test is not required.
And then what about the teachers?
So it depends on if the teacher met that close contact definition or not.
Yeah, if the teacher or the student.
I would say at this point, because there is increased capacity for testing, the teacher should be tested. But, and the schools, by the way, all of those that open up to face-to-face, they have criteria built in for frequency of testing staff. They're supposed to be testing roughly every 2 months and about 25% of their staff every 2 weeks. So they do an additional test. And then the additional test would be probably at day 5 to 7 from the point of exposure. And Dr. Umerji pointed out that in his slides that you don't want to test immediately day 1 or 2 after exposure. You want to test a little bit further out. Now, whether that teacher is isolated or not, it depends on how closely exposed that teacher was. And I'll just give you an example to kind of bring this full circle. In a middle school classroom, you can use this numbers game that I talked about. But I had an example of a preschool with a bunch of 3-year-olds, and a 3-year-old was tested positive. And a 3-year-old cannot mask. The kids cannot maintain physical distancing. They're sharing toys. The providers have to feed the kids, or some kids are in diapers at age 2. There were a variety of kids in this classroom. So physical distancing and those rules were out the window because this was a preschool classroom. That classroom shut down for a full 14 days. All of the students and the teacher. And so it's a very individualized decision, but in the elementary and middle and high school, you can apply that rule. And this is what IUSD does. They contact only those families whose kids were close contacts by the CDC definition. The other kids are not notified. We see posts all the time on social media. Oh, there was an exposure at this school, there's an exposure at that school. But the schools are really on top of identifying who the close contacts are and working with the local or with the pediatricians and physicians involved.
What is Dr. Ibrahim, you actually mentioned something about indoor versus outdoor. Is there much data on, are outdoor sports activities okay, or they're not okay for the kids? I know, Dr. Altaf, you had asked that question yesterday, or had posted that in your comment to me. I like both of you, because this is very common, right? Can our kids go play basketball in the basketball team in the league, in my city?
We know the virus degrades as it's outside the body, and in certain conditions help it degrade faster. So being outside, UV light, that helps degrade the virus faster. And then being outside, you have ventilation where these droplets aren't, they don't transmit as easily as to a person, next to them. So outdoors is much safer than indoors when it comes to sports, when it comes to anything. And basketball and other sports, football, these require people, you're in another person's, within inches of another person's face at times. And so even being outdoors, sometimes that's not enough distance. And
COVID basketball is pretty good, Ibrahim, because you can stay 6 feet away from the defender and you can shoot all you want because they can't.
True. Some people play defense.
So outdoor, you're saying is yes, no, maybe sports wise?
I'll answer that question too, because I work with one of the local basketball leagues here in Irvine called SoCal Elite. I was a coach for a number of years for them, and they suspended all operations when the pandemic hit in March. Recently, they restarted a modified format in September. And it was outdoors. They have contracts for all the indoor gyms in Irvine, but they played outdoors, and they didn't play basketball in the traditional sense where we guard players, but they divided kids into small cohorts of 6 kids each. So if there was an exposure, it was easier to isolate rather than isolate the whole league. And so that was rule number 1. Number 2, it was all outdoors. Each kid had their own basketball. They didn't touch each other's basketballs. And they masked up until the point where they were doing the drills. And once they were on the court and engaged in actual physical activity and running and things like that, then they removed their masks. And they did drills with various combinations of setting screens, picks, etc., and shots. And they competed against another team that was on the other half court, but physically distanced. And there was competition by virtue of baskets scored. but there was no guarding, no rebounding. And they have a phased approach where they hope, if the local health department allows it, that they're going to try to have more competitive games in January, but it will be outdoors and not indoors and indoor gyms. So it'll be, dependent on whether we could get rained out and things like that. So I actually volunteered and helped them with this, because I feel there is, it is important for our kids to get off the couch, get off the screens, and get outdoors and get physical activity and interact, but we need to do so in a format that is safe. So it was not traditional basketball, but it was drills. My Ismail got out, got to shoot some hoop, got to see some of his buddies. And so I think there's value in that, but we have to be smart in how we do it.
Okay. Munaf, are you still on? I don't know if Munaf's still on. Okay. Because I think, Ibrahim, you mentioned that the coming backwards a little bit, infants, you're saying about 2% of newborns of women that had COVID-19 were infected within 24 to 48 hours. Is that correct?
About 2%. Yeah,
so what do mothers need to be worried? Because, obviously infants, their immune systems are not fully developed yet, right? So are there any precautions that mothers should take that are young or that have young babies?
Well, the universal precautions we're all taking. So if you're speaking about infants that were just born.
Yeah, what's the vulnerabilities I'm asking, I guess?
On paper, it would be higher. And you would think, if we're pattern this sort of like the flu and other viral illnesses, we would think that you would see more newborns and, such younger kids or younger infants have problems with COVID. But like I said, as far as I know, I don't know if there's been any really severe outcomes, amongst those 2% that tested positive. I think the vast majority of those did okay. So the universal precautions, masking when you're breastfeeding the baby or around the baby, if you're taking care of the baby, and that's if you have COVID yourself, and then relying on the other part of that care to someone in the home or someone else that can handle it if it is possible.
So the virus is not really being transmitted through breast milk or something like that?
And as far as we know.
Okay.
I think in some instances they've isolated it, but there's one thing isolated and one thing how infective that virus is once it's out of the body, and so you might find traces of virus long time after after a person's gone out of the room or whatnot, but the infectious potential of that virus particle is not there, or it's much lower.
Okay. So
I have a question. There's all these holiday, obviously the holidays are coming up. There's going to be gatherings there's Thanksgiving and then winter breaks, and, families want to get together. What are you guys' thoughts on that?
So I think we all will agree that human beings are naturally social animals, and that we all, to some degree, have quarantine fatigue. I think we would all agree, that all of us on the phone and those who are on the webinar, that we want to see our loved one, we want to see our families, but we have to continue to be vigilant and smart, just like we talked about sports and school. While driving into work today, I just heard a statistic that there was a survey done of Americans, and 2 out of 5 that were surveyed were planning on attending a Thanksgiving gathering with more than 10 individuals present, and 1/3 were planning on not requiring their guests to mask. So if we go down that route and this translates to reality, we could be facing a mandatory lockdown in Christmas and New Year's. And that to me is just very, very alarming. That being said, I like to focus on practical advice. So what do we do? How do we approach this? Do we just stay locked up? Do we stay in holes in our home? The LA County Department of Health came out with some guidelines on safe gathering. And so I'll just tell you kind of what I do with our family. Like Dr. Omarjee mentioned, the virus is much less stable outdoors. So outdoors is better than indoors. What I've done on the last 2 Eids is we have expanded our cohort a little bit to include my 2 brothers' families. And so, provided nobody is symptomatic and nobody is sick, we have gotten together outdoors in a backyard or a park. We wore masks until the point at which food was served. When food was served, each family had their own individual table to sit at, and they removed their masks and they ate at that table, and the food was already plated out or put in serving dishes on each table. So people were not lined around one table like a buffet table to get food. And so alhamdulillah, we were able to see each other for Eid. We were able to have that human need of seeing people rather than just being on a Zoom call. The kids got to play a little bit, but when it came to service of food and masking and trying to maintain physical distancing, we were smart about it. And so I would say limit the gathering to no more than 10 to 15 people, 2 or 3 families. If you are going to do it outdoors, be very mindful of your behaviors when food is served, because that's when masks come off, when people start laughing, talking louder, respiratory droplets can be propelled farther. And as Munaf had mentioned earlier, there's a vast percentage of people that may be asymptomatic or in that pre-symptomatic phase where, you have not yet developed symptoms, but you will 2 or 3 days later. And we have no way of knowing that, even if we're well-intentioned. So we have to, institute all these cautions. So that's what I would say with the holidays coming up.
What about the touch surfaces, Dr. Altaf? What about like the, spoons that you're using to,
So we had separate serving utensils and separate utensils for each family on each table. So there was no cross-contamination of touching surfaces.
Right. So it can also be transmitted through touching the virus.
Correct. Depending on what surface it is, the virus can stay viable for several hours to a few days, depending on what surface it is.
Okay. So before we wrap up, and I hand it over to Hani, first of all, I want to thank you, Hani and Spora, for again putting this together. It's very, very informative. One of the things I've gotten, guys, is that if you guys are willing to, the doctors here, to do something for schools specifically, like for Minaret specifically, and for OCS specifically, things like that. So we'll talk about that with you guys potentially with just teachers, any questions for each other? I mean, since,
Sana, if I can offer just a couple of words, this is just personal belief and stuff like that. Being a frontline worker who's worked across taking care of these patients, actually diagnosing these patients, seeing them on initial presentation, there's no screen for me. And how I manage this and how I found the courage and, faith to go to work and take care of these patients, because if you're going in, you're taking care, you have a high possibility you could get it. I live with elderly parents. I have young children at home. And so these are all issues for me that I go to work at. Every day I go to work. How I have maintained for the past 9 to 10 months is the same way all of you have maintained, with common sense, with faith, and, using and exercising proper judgment. A lot of this boils down to, like, we talked about recommendations, we could give you guidance, but a lot of this is basically personal accountability. The onus is on you. You have to be responsible. If your child is sick, a lot of parents like, well, I got this important meeting tomorrow, but my kid has got a little cold. Do I keep him out of the hospital, keep him out of school, keep him out of daycare? So this is, again, accountability, So things I want to just kind of mention real quick, we talked about principals and, administrators on this chat. One thing I would share to you is treat this like, how would you worry about it when the flu outbreak is there? You would treat it the same way, right? And that's the most similar virus we're comparing it to. But, this is not MERS or SARS, but it's the same family. But the presentation, as we know of date, is kind of very similar to the flu. That's why we say it's kind of like the flu. We don't treat it like the flu. It's a little bit different. Using Tamiflu, using all these things, there's all personal recommendations on that, guidelines, and there's recommendations, but do people use it or not? Again, it's all personal choice. So what I would tell you is exercise judgment in that scenario where, how you would do it in a normal flu, because we've been dealing with the flu every year, and as Umar pointed out that, Ibrahim pointed out that, the deaths from flu complications or the morbidity, not only mortality, is much higher, right? And that's something that we need to worry about. So vaccinating for the flu is a big thing. I mean, Ibrahim Altaf, Munaf, you guys would all agree upon that. But what I would definitely tell you guys is that a lot of this boils down to when and how you want to affect possibly other children who may be potentially going on and infecting other people, right? So if you have a positive patient at school, like, a lot of these things right now, you got to isolate them. It's simple. It's a positive test. Doesn't matter, even if they're asymptomatic, because those are CDC recommendations as well.
It's just that when someone recovers from the flu, let's talk about the flu comparison, right, Shema? It's like if someone recovers from a flu, we're not waiting. There's no 10-day isolation, 14-day isolation. It's just like, okay, you're done. You go back to school, right? So it's different from that in that perspective. And I think also the difference is, and I hear what you're saying. A lot of it, right? I mean, we have our faith has to come into place. I mean, as well as our psych, because a kid that's 5 years old, 6 years old, first grade is not going to understand why they're being isolated all of a sudden. Right. There's a lot of psychological issues that goes behind isolation for both the parents, but especially for the child, right? So we have to be fairly cautious with that. The difference for me is that because it's a novel virus, right, our immune systems aren't prepared for it. And so with the flu, generally speaking, our immune systems have seen it before, and we'll figure it out, we'll fight it out, and we'll get rid of it. So that's why it's so important to be cautious to not give it to those that are more vulnerable. Right. And that's why it's such a push to say, okay, prevention, because it is different from the flu from the perspective of its novelty to us.
Right.
And just for folks to understand, we have the capability of fighting this virus. Don't mistake that. It's just that how long does it take to fight the virus matters. Because what happens is that if you take your body 2, 3, 4 extra days of reaction time, which it wouldn't have had we already been exposed to the virus, that's 3, 4 extra days that the virus has a chance to expand in your body. Mm-hmm. So those that are vulnerable are going to be at risk because the extra 3, 4 days that the enemy has had a chance to knock on your walls. Okay.
So that comes down to some of the accountability part, right? Because you're saying 4 days. I mean, there's recommendations saying the incubation period's 8 days, and that's why they're saying isolate for 10 days, 14 days, right? So what I'm saying,
that's not the 4 days. I'm sorry, I don't want to get misinterpreted. That's not the 4 days. What I'm saying is when your body starts to fight, if it already has the antibodies, it's an immediate reaction to the fight. If it doesn't, then it takes longer for the bodies to form those and then start the battle as it does. Those that are vulnerable can potentially, their hearts may not be able to pump out as much blood because the lungs are now fuller, right? And so that's what I meant. And that's a whole different discussion.
I think one thing to just remember when we talk about kids in isolation is that we're not as, and I think we've hit on this point, but I just want to make sure everybody understands that we're not as worried about the poor outcomes in kids. As Dr. Mujib pointed out that, the death rates in kids are exceedingly low, like 0.0001%. And all of my kids have recovered at home fine. None have been hospitalized in my panel. But we're really worried about mitigation of this virus and spread in the community to high risk and vulnerable individuals. And can sick kids contribute to the 240,000 deaths that we have in the United States?
Absolutely.
That's what we're really talking about. Yes. And the incubation period, unfortunately, for this virus, it behaves very differently than flu. From the point of contact for flu, you're looking at 1 to 4, maybe 1 to 5 days where you develop symptoms. For this virus, it can hang out in your body for 12, 13 days before you get sick. And so that's where, if any child who is symptomatic, really we should have a low threshold to test. It's not because we can't treat it there's no cure for it and the kid's going to stay home and get better on its own. It's because we need to keep that kid out from potentially infecting high-risk people for that full duration of that incubation period. And that incubation period is very different for the flu and this virus. So that's what we're really trying to do, is prevent widespread disease activity in our community where, 50, 60, 70-year-olds end up in the ICU intubated because a 5-year-old had it. Yeah. That's the take-home message.
Yes.
Altaf, I know we're going into overtime here, right? But
sorry about that.
No, I don't, sorry. I'm saying this is very important to understand the concept of flattening the curve.
Right.
Really important to understand why we need to flatten the curve. First of all, I think everyone should understand that we're all going to get exposed to the COVID-19 virus in our lives. Mm-hmm. This thing is not going.
We already have not been. If we already have not
been. There's no question. This is not going away, vaccine or no vaccine, okay? What's important is that we limit the number of people that get sick at the same time, because our systems, our hospital systems can get overwhelmed with this, and we can be in a position where we cannot provide the care we need to because of the amount of patients may show up all of a sudden altogether. And we run out of supplies or shortage of beds and all that stuff. Our system is not prepared for a massive influx of patients. So if those patients come in over a year's period of time versus a month period of time, very different outcome in terms of fatality.
Right.
Correct.
That's the concept of flattening the curve. That's why you want to make sure that less and less of us are exposed at the same time. The exposure will happen. It's just you want it to happen over a longer period of time. You know, and the other thing is the number of people that are infected at the same time is also important, because then that doesn't allow you to flatten the curve, because those same people can start affecting a lot more people sooner, right, in the population. So again, keep in mind that even if your kids are not as vulnerable as Dr. Ibrahim had pointed out to fatality, one we don't know is potentially what other effects it can have in the long term. The second thing is that we don't know who they might actually end up giving it to, like Dr. Altaf was just saying, right? So we got to flatten the curve by everybody working together to minimize exposure for as long as possible to this virus. I don't know if that you guys
I have a quick question. Are children just as capable of transmitting the virus as adults? I mean, I know like the danger is a little bit, you know, like less, but to themselves, but as far as carrying it, like, is it
so the virus itself is going to be the same virus, Safura. It's the fact is kids are a lot less careful about, you know, when they're going to sneeze, they're not going to, or they're not going to look away or use it, right? So there's the vulnerability from children passing it on to adults is significantly higher because of the fact they're going to be a lot less careful.
Preliminary data to answer that question, there have been some elegant studies done internationally. The younger children tend not to spread it as efficiently to adults, but they spread it amongst themselves more. And that may be that they don't sit as tall, and there's a lot more sharing of germs among themselves. If you think about how 3 or 4 or 5-year-olds play, there's a lot of sharing of toys, a lot of hand-to-mouth behavior, putting toys in their mouth. And so there's more effective disease transmission among their own cohorts than there is to adult caretakers when they've done elegant studies with contact tracing. Now, the same does not hold true once you start getting to middle and high school. Those kids can probably spread as efficiently to adults as adults can spread to each other. And therein lies some of the guidelines where schools, for the principals on the phone, K through 6 and preschools are allowed at this time, if your county is in the red, to have traditional 5 days of school face-to-face. Whereas once you get to middle and high school, the most that is allowed for face-to-face is hybrid with a maximum of 2 days face-to-face and the rest virtual. So there is some of that evidence. The answer to your question, Safura, underlies some of the school opening guidelines as well.
Dr. Shema, you have a CDC chart potentially?
Yeah. So I'm actually forwarding it to you right now because I'm already in the Zoom call. It's not going to allow me. Apparently my MacBook settings was not placed properly. So okay. I just sent it to your email, and it's a good flow sheet for a lot of it's from the CDC recommendations about
when. Can you send it to Hani, because he has the list of all the Facebook and all the people on chat and stuff.
I'll send an email to everybody with that information. Inshallah. Jazakallah khair. We'll post it on Facebook as well.
Cool. Yeah, that'll be very useful. Hani, take over again. I guess thank you, all of you guys. Great. Seriously, I'm learning so much even being in the part of the panel. It's great. So.
Jazakallah khair, Dr. Sana. I just wanted to thank Dr. Altaf, Dr. Ibrahim, Dr. Shahman, Dr. Sana for this informative, very important webinar, inshallah. And I just wanted, we covered, and this is part 2. So in part 1, in part 2, we covered a lot of the medical aspects of the, with COVID-19 and our children. Just wanted to kind of be respectful to everybody's time and just talk about just the legal aspect of it, just how it's important. Just a reminder how it's important to have your Islamic will, your trust, your advanced healthcare directives, your kids protection plan, just to make sure that basically you keep your family out of court in conflict, and you make sure that your kids would be absolutely protected, inshallah, if anything happens to you. You know, as your family protection lawyers, you know, at Cornerstone, we work, inshallah, very hard to educate our community, you know, that, you know, it's very important to have these documents, and that estate planning does not have to be this scary thing, that it's actually a wonderful tool to help your family. So a lot of our clients that we talk to, they say, you know, if something happens to us, our father, our parents, our in-laws can take care of our children. It doesn't happen like this because, you know, they have to get appointed as legal guardians in writing. And if it's not in writing, then, you know, they have to get in front of a judge. And during these crazy times or during normal times, it's not easy to get in front of a judge. And same thing with advanced healthcare directives. We just want to remind everyone, our community members, our clients, to be organized, because even, you know, God forbid, if something happens, your advanced healthcare directives needs to be in place properly, you know, basically handling COVID-19 language, because even your own spouse, as everybody know here, you know, even your own spouse cannot make medical decisions if it's not in writing, if you don't have your advanced healthcare directive. And even beyond estate planning too, I want to cover a little bit about the financial aspect of things too, especially during these difficult times. I mean, you know, the financial stress could be potentially more deadly than the COVID-19 aspect of things too. You know, we've been noticing, especially with our Muslim community during COVID, a lot of our cases that are coming to us, you know, that discuss a lot of employment law issues, personal injuries. You know, we're seeing a lot of our community members, you know, have been injured by, you know, the negligence of their employers. You know, they're getting bullied, pressured, intimidated into like setting for less than they deserve. So, you know, we've really, you know, as family protection lawyers, and this is what we are working very hard to brand to our Muslim community, make sure that they are being represented legally in the best manner possible, inshallah. And
that's interesting, Hani. So what you're saying is, I mean, if, let's just say, Altaf, if kid gets sick and the parent has to stay home from work, is there any legal protection for them to be able to stay home and take care of the kid in isolation versus?
Well, absolutely. You know, there is certain aspects of it, laws of it, you know, whether it's pay, you know, wages, you know, how to handle that, how the employer has to handle that, making sure that they're getting the right wages, making sure that they're getting their, you know, their time for that. But also, you know, they've been wrongfully terminated if this happens and there's no caregivers to the kids. They're also being wrongfully terminated.
Can you do actually a webinar on this?
Oh, absolutely.
I mean, I'm just now thinking, Altaf, we were talking about how do parents, when their kids have it, what do they do? What they do? Like, that's the kind of stuff.
We supply the caregiver leave if the child is sick and needs that period of quarantine. The legal aspect, I would defer to Brother Hani. But we certainly, as pediatricians, we are used to supplying caregiver leaves that are documented medical letters that certify that the child is sick and needs to stay home for this many days.
But
if there's no other caretaker
doesn't allow for that, right? You may do that leave, but the employer doesn't allow for it.
Yeah, so that piece of it, I would defer to Brother Hani. I don't get involved with what the employer allows for, but on the medical side, we justify that yes, there is a need for this parent to stay home for this period of isolation or quarantine because the child has no other caretaker.
So Hani, you need to really talk about the rights of the employee in this kind of scenario. I mean, I don't know him. I don't know it. I haven't really thought about it. I mean, in our company, obviously, we actually give them the 14 days off and all that stuff, but maybe not everybody does.
Yeah, no,
I'm not sure what the rights are of employees in that scenario.
Yeah, there's certain laws that are discussing the wages and how they should get paid and how long do they take, basically. So we have very experienced lawyers, injury protection lawyers that can handle, you know, inshallah, these cases and protect and fight for our clients' rights. Not only that, but just making sure that they are getting their settlements, they are getting paid fairly, and inshallah, that is a good thing, support that we potentially could organize with our, you know, experienced employment law litigation lawyers, that inshallah we can set something like that up.
Interesting.
So,
okay, thank you everyone for joining us, and as usual, you guys provide lots of great information, very helpful and relevant, and inshallah Anyone else had any comments? We're good.
Ibrahim, thank you for putting it together, all the PowerPoint.
No problem. No problem.
And
Yeah,
guys,
thank you all of you for joining us today.
I think Manaf had to go, he's working, but he was still joining us from the work. That was amazing. So
Mhm.
you guys are awesome.
It
Seriously.
was all done.
Alhamdulillah. Okay, inshallah. We'll see you guys.
Okay. Assalamu alaikum.
Assalamu alaikum.